Hi everyone, my name is Bryant Londono Escobar, and this video is my final submission just to share with everybody what the experience is like to be in the Work Integrated Learning course for Black students in health. So this course overall is about connecting what it is to apply your skills and what you've learned in your degree in the real world health setting, especially when working in the health sector. A lot of the time it's hard for us to bridge the gap of being able to get into these spaces, to be able to share your knowledge, be able to learn a lot of skills that you don't get in the classroom. So overall, the course for this summer, you take about 100 hours of experience working in a health field. My opportunity was at Humber River Hospital. This opportunity focused on what it is to manage a hospital, understanding that issues don't always necessarily come from the moment that you're in the ER. A lot of the issues come from management. Understanding that from the moment that you walk into a hospital, you have to check in. A lot of the time, what we had to deal with was a lot of health analytics. So from the moment we came in, we had the opportunity to learn from our supervisor, Mary Chris, and we had to be able to take some knowledge from what we learn in our degrees to apply it into the deliverables we had to provide. From the beginning of the session, when we first came into our placement, our first task had to do with working with a lot of tools that we learn in class here. Working with Access, working with Publisher, working with Excel. A lot of these tasks that we find very, very minimal at the start, but the moment we got into this placement, we realized the value of the learning experience we had at school. We got in there and our main task was understanding how does health management work overall. It talks about how many employees are going to be present at one time and the issues that human resource can really create in an ER. Our hospital system in Canada right now, especially the emergency rooms, are a very delicate system. And what we've realized is a lot of issues came from staffing problems. So what happens is from the beginning, we came in to understand what the VIP management system was and realizing that this was going to be the new program that they were going to use to understand how staffing can be resolved. It all started in steps. The first step was understanding where the issues came from the managers. Managers had an issue where there was a disconnect between human resource, the managers, and then the actual staff themselves. Humber River Hospital is one of the first digital hospitals in North America, and it's the first one in Canada. So understanding that going into the new age world and understanding that digital systems are going to be what takes over everywhere, this hospital implemented everything all the way from AI to understand how their health systems are going to work, understanding how they're going to start the ER process from the moment a patient walks in, and all the way towards the end where the patients have to actually leave the hospital. What happened was when we came in, we got the opportunity to analyze the data from the managers, see how many staff they think they have, see the human resource records and see how many staff they have budget allotted for. And we had to be that bridge to understand what is the actual amount of number of patients there are, and staffing there are, and then afterwards applying that data to provide it to the project managers. Project managers were there to understand what the issue is from the start. They were provided an issue. The issue that we were provided from the beginning is, we have this many postings and we have this many staff. There's a disconnect because what happened was there's way more staff in some areas or not enough staff in some areas, so the departments weren't running effectively. How does this impact the daily user on the day-to-day? The problem was that ER times are longer because what happens is if you believe that there's a certain amount of nurses, but there's less than that, the ER times are not going to get any better. Our job in this placement was using our skills, using our critical thinking skills of understanding where we can actually fix these errors. So what we did is throughout the manager's logs, we saw how many employees they had. We had to go through all of these lists and see how many duplicate accounts were created. This means that people that were on sick leave, disability leave, maternity leave, or any other type of leave might have been duplicated in the system. So the moment they left, the moment they came back, they might have been in the system twice. Another error that we had and that we faced a lot of actually is, for example, nurses can also upgrade their licensing. They can start as an LPN, an RPN, they could have started as a PSW, and then they upgrade their credentials. What happens is in the system, the nurses that were in charge were putting them multiple times in the system. Again, this is creating errors within the system that we further understood impact the actual functioning of a hospital. The second part of our placement was understanding the actual project management aspect. This program that we were implementing in the hospital was called VIP. The VIP system is there to be able to create the vacation leaves, if anybody had to put in any type of reminders, or if they had to put any type of modifications into their scheduling, they would do it directly from the VIP system. So what happened was, this system would be fixing a subset of issues called grievances. Within a hospital, within different faculties, even for example at York, there's something called grievances, which is like issues. If there's something that's not going properly or something going wrong, you would submit a grievance to the system, and in this system you would be able to see, okay, maybe there's issues with scheduling, maybe there's issues with scope of practice. Some of the largest issues within the hospital system at Humber River Hospital is actually the scheduling errors. For a lot of nurses, they work off on seniority. One of the big issues is that younger nurses and more experienced nurses have a disconnect with when they're able to schedule overtime or when they're able to schedule their regular working shifts. This VIP system would allow people to submit their grievances directly onto the system, which solves about 25% of the issues in scheduling within the hospital. So what happens is, throughout those grievances, we went through the list. We looked at all of the issues that were going on, understanding maybe scope of practice is an issue. Why are these scope of practice issues going on? And understanding that if there's a scheduling error, how the VIP system can make this process more efficient. So our experience was a group of 4 of us students. We went in, again, we started off from analyzing what the duplicates were in the system, understanding that maybe there's too much staff, maybe there's not enough staff, and understanding that this issue came from not implementing digital systems, even though the hospital is completely digital. The second part, the program management, project management, which was actually showing why implementing VIP is going to be efficient in fixing a lot of these errors. And the third stage was understanding the grievance list, understanding that VIP can fix about 30% of the issues that have to do with scheduling and that have to do with actually vacation planning or leaving or scope of practice. So overall, the summary of this experience is really understanding how hospitals run, how hospitals work, and the back end of how everything is actually managed. Human resource, just as much as the people at the front line, are extremely important into how the functioning of an emergency room works. Considering even outpatient situations where they have to have enough cooking staff to be able to create this, the meal plans for all of the patients. So overall, that's just the 3 stages that we went through throughout the experience. And further, I'll explain sort of what our experience was just personally learning and actually understanding what it's like to work in a hospital. We're just gonna have a little bit of discussion, especially with one of my close classmates at the hospital, because we had the opportunity of working together at Humber River Hospital. So please introduce yourself.
Hi, my name is Christiana. I'm a student under the Faculty of Health.
For sure. So we're just going to go over a couple of questions just kind of to see what your experience was at the hospital, especially because all of us had a different perspective of how the experience went. So just to start off and get things rolling, how did you feel, especially at the beginning of summer when it was the peak of summer, how did you feel going into this placement?
I was a little bit scared, not really sure what to expect, especially being a psychology student. I was looking for a very specific experience. And yeah, that's how it was going into the program.
For sure. And I know a lot of us, when we first started, we didn't really know what the end goal was. And it felt like we were just kind of doing tasks where we didn't see what the bigger picture was at the end of the day. So when you did get in there afterwards, what did you feel like? What was your impression of the task they gave us at the beginning? Like when we first started the placement, what was your impression of that when we first got in?
Well, again, like I said, I was looking for a very specific experience, and I feel like when we did eventually get to the hospital, it wasn't exactly what I expected. And initially that was like, kind of felt like we were out of place, like we weren't like put in the right area. But with time, we really grew to see that like you really need to be open to like any experience, because experience is experience regardless of whether it's exactly what you want. And I feel like in doing things that we didn't like intend to do, we ended up opening doors to like even better experiences, which were a bit more directly related to what we wanted to do, which included things like networking with like people more closer to like our goals. And yeah.
Of course, and especially the connections that we did make in the hospital, it really improved the experience because we had the opportunity to see clinicians that are in the psychology field, seeing what it's like going through the perspective of a nurse or seeing through the perspective of managers and project managers. So I feel like that was also a very big part of why they wanted us to get introduced into those systems, especially when you really look at it, there's a lot of underrepresented communities, especially in the Black community, to get into the health sector. Because when you really looked at it, you saw there wasn't that many Black workers at the hospital.
Yep.
But it gives motivation for us to be able to move forward and actually get into those positions moving forward. And overall, what do you think, how did you feel in this placement? Did you feel like, as a Black woman, did you feel like it was a different experience? Did you feel like there was some parts of the experience that weren't the most pleasant?
I wouldn't say that. I'd say like in any environment that I step into, I feel like I am aware that like I am a Black woman. I feel like we were lucky enough to where our experience wasn't really like us being Black didn't negatively affect our experience. Like it wasn't something that we could hide or anything, but it didn't really take away from our experience. I would say though that it did like encourage me to want to like take up more space, because as you mentioned, we aren't really as represented in certain spaces. And so yeah, going forward, I definitely do want to take up more space in more professional settings, and yeah, kind of just being the representation that I want to see. Because yeah, there wasn't that many Black people there, and although that didn't take away from the experience, it would have made it better if say there were more. But
especially in the sector that you said you like to work in, when it comes to education and working in policy for education for underserved communities. So it is really important to have that representation there to understand what the needs are for these different communities, when a lot of the time you realize that there's a lot of maybe other cultures that are more represented, like seeing how there's a lot of white men in upper management and understanding that they're making policy that doesn't somewhat represent the people that they're actually serving. So thank you very much for answering my questions. I really appreciate you having here, and then maybe we can have further conversation about this at another date.
Of course we can.
Thank you very much. So now that we've had a little discussion with one of my classmates that was my colleague at the hospital, now I'm going to share a little bit about my experience, and I'm going to have them ask me the questions.
Okay, how would you describe your overall experience in the program?
So I feel like, again, like I recapped before, the program started off very slow with tasks that we didn't really see the meaning of. But as we progressed through the program, we really saw the value of how the small tasks at the beginning really make up the work to actually implement these big protocols that they're trying to put within the hospital to really make the hospital have a better management system and run more efficiently overall.
And what were some new things you learned through the experience that you didn't know before?
So I always thought and assumed that the people that run the hospital are only the nurses and only the medical staff. But you really come to understand how essential it is to integrate everybody within the experience, whether it's the cleaners, the people sanitizing, the people that are helping run the front desk. Everybody that's in management is essential into the running of a hospital. And realistically, I didn't value or consider those things before this experience. And understanding that how this VIP system can now make things run more smoothly, it really changes the game for how the ER can run now. So I think that that's something that I really came to learn from this experience overall.
And how did the program help you understand the chain of command in a workplace?
For sure. So regardless of the fact, wherever I go in, I understand that there's always going to be a certain chain of command, especially when you go in, for example, to university. You know your professor is above you. They're the person that's educating you, they're the person that's instructing you, they're the person that's teaching you, and you have a set respect for them. In the workplace, it's interesting to understand that there's different social dynamics when you go in, especially when you feel already as a minority walking in, understanding that you feel like you're at a point of disadvantage, understanding how to talk to people, what the appropriate terminology is within the workplace, and understanding who you actually report to. I think one of the biggest things that I've come to understand within this experience in regards to the chain of command was knowing who you directly are working under. There's always the employee, there's the project manager, there's your manager, there's the supervisors, and the more you head up, the less information they have on your day-to-day tasks. So a lot of the time, it's understanding to explain what information to who, or understanding who it is that you report to and where you need to go to actually ask resources for questions. It's important to always be able to be open and not have the shyness to ask a question, because it's worse to make a mistake instead of actually asking the question and learning from that experience. Learning that your supervisor will have the information to maybe make your day a little bit easier, or understand the proper protocol to make sure you're always following the rules, especially when you know that you're just starting out in the health sector, where every decision that you make can be the difference between someone's life or death. Or if it's not that, understanding that it's your responsibility to know what your roles are and protect your position within the company.
Okay, and now that you've learned these things, how do you see yourself applying them moving forward in your studies or future career?
So I feel like I always see myself working as a clinician in a hospital. So understanding all the little bits and pieces, whether it comes from project management, understanding the value of all of the employees within a hospital setting, and understanding the chain of command, it really gives me a good guide for me the moment I actually step foot into a hospital as a full employee, knowing what I have to do to find the resources to properly do my job, understanding how important it is for me to do my job correctly, value and appreciate and respect all of my colleagues, especially within a workplace where everybody's essential like a hospital, and being able to be present and do my job as best as possible. So overall, the experience was like, you can't put a price on this experience due to the fact that there's so many things that you can't get in the classroom. Overall, thank you very much for watching this video. It's just for me to be able to share a little bit of our experience, what it was like working in the hospital and having this opportunity to be in this placement, because it really is a special opportunity. So if you really get the opportunity to join this course, feel free to join. You'll learn so much, especially the things you never see in the classroom. Thank you and have a nice day. We're just gonna have a little bit of discussion, especially with one of